heart disease in women is real. Bago makapagpatingin ng isang babae sa mga nararamdaman niya, nauuna lagi ang lalaki.
Doc, this comes as a surprise to me.
And we forget the heart.
Good day, everyone. I'm Dr. Jing, and welcome to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. Today is special as we celebrate Wear Red Day, and joining us is none other than Dr. Edna Lim, the esteemed head of Women's Heart Health. Doc Edna, thank you so much for being with us today.
Thank you for having me, Jing. It's a pleasure.
So let's dive right in. Heart health is a topic that affects us all, but today we're putting a spotlight on women's heart health. Doc Edna, could you please share some insights as to why women in the Philippines should be paying attention to their heart health?
Okay, so everyone should know that the leading cause of death globally or worldwide is cardiovascular heart disease, or what we call heart disease. So this is important for women to know because that's our heart health. Another thing that we should know is the risk factors for these heart disease, which include high blood pressure, high cholesterol, especially our LDL cholesterol, or what we call bad cholesterol.
We tell our patients na lechon de leche is bad, no?
Correct,
LDL.
correct.
Yun yung sinasabi ko sa patients
Yes.
for them to remember.
Correct. Yeah, that's correct, Dr. Jing.
So
no?
hypertension, cholesterol,
Diabetes and obesity, to name a few. No, so it's also important, no, for us, which is unique in women, is we should know the impact of hormonal changes during menopause, which I am going through right now, and maternal health during pregnancy because of the presence of gestational diabetes and preeclampsia, which can impact our health as well.
I see, Doc. So aside from those risk factors, Doc Edna, is there anything else that is peculiar or unique to women?
Our society is predominantly patriarchal. Ibig sabihin nun, parang bago makapagpatingin ng isang babae sa mga nararamdaman niya, nauuna lagi ang lalaki na magpatingin kesa sa ating mga babae, even though we already experience identical symptoms.
You know, Doc, this comes as a surprise to me. No, I didn't really realize it to be like that. All along, I've thought that men have poorer health-seeking behavior, but you're mentioning this from studies.
Yes, so if men experience chest pain, no, they would seek immediate attention. While women, no, if they say, I have this discomfort in my chest, so what they will say, oh, it's nothing, it's all in my head, or I will just lessen my stress.
Or Doc Edna, it might not be, it's in my head, it might be like some other people saying, oh, nag-inarte ka lang.
Yes,
ganyan.
correct.
Pwede.
Like it's akin to a psychiatric
I see that they were emotional.
illness or emotional.
So Doc Edna, those are really important messages, no? Yung are being
Yes.
patriarchal in the country, risk factors, and how women should be on top of things when it
Yes.
comes to their heart health. So Doc, what are the usual signs of heart disease, especially in women?
When we speak of women's angina or chest pain, it is usually described as chest discomfort, not the usual pain or heaviness. And it also radiates in different parts of the body. No?
Okay, so
like
it
left arm, but sometimes even both arms are
I see.
involved.
So it can be a heart issue even if it radiates to the right
Yes,
arm.
or
I
both
see.
arms, yes.
Okay.
And then even up to the jaw, there is jaw pain, neck pain, back pain, and intrascapular. So it's between your scapular area at
Yes,
the back. No?
So that can still be heart disease.
Yes, that is an atypical presentation.
Atypical, meaning not very common.
Yes. So another thing that we found out is that shortness of breath is usually a typical presentation. What does that
Hingal.
mean? Yes, hingal. So it's unfortunate that shortness of breath is sometimes misdiagnosed as a pulmonary or galing sa baga.
Asthma.
O
mga ganun,
asthma. So
or
nami-misdiagnose siya, no?
I
So, ang tendency is i-work up natin yung sa lungs and we forget the heart.
It's an unfortunate.
Yes, it's unfortunate. No? So, how do we go about it in seeing our patients and knowing that this symptom is cardiac already? We look at it holistically. So, we look at if she has a family history, she has these risk factors, and then the presenting symptom, be it atypical or the typical chest pain.
So, Doc Edna, can you please share with our audience practical lifestyle tips for us all to have a healthy heart?
Okay, it can be summarized as eat right,
Eat right.
yes, move more, and
Move more.
sleep better.
I see.
So
Eat right, move more, and sleep better.
So eat right means, of course, we should choose fruits, vegetables, and lean meat, no? Other than red meat, food rich in cholesterol.
Mga sangyupsal na yan, Doc. I
Yes,
think we have to
correct.
lessen. Masarap pero dapat bawasan.
Correct.
I see.
And concentrate on eating healthy instead of frying our food. We should bake them, grill them, or steam them. No? So
It's in the manner of cooking. It's very
Yes.
important.
And I think it's better to eat home-cooked meals. So because you can
Regulate.
remove the salt, lessen the sugar for your desserts.
You know, Doc, I always bring lunch from home.
Oh,
I'm a
that's-
baon girl.
Ay,
I always
ang
bring.
galing. That's
I try. Para tipid.
that's good. That's good. To
Aside
know.
from yun nga, like you said, we can regulate the salt and the amount of like vegetables,
Sugar,
fiber.
yes. And we cannot overemphasize drinking plenty of water instead of all these colored drinks that we
Water
have.
over colored drinks.
Yes. Okay, so the next is move more. What
Move
does that
more.
mean? No? So parang ibig sabihin, aim to exercise, meaning at least 150 minutes of moderate intensity aerobic exercise per week.
In a
yes,
week.
per week. So
150 minutes per week.
per week, yes, per week. Sorry, it's per week. And a sample activity is 8,000 to 10,000 steps per day. We also encourage everyone to use the stairs instead of the elevator or the escalator, and essentially move about every day. No? Move about.
And I think Doc, Philippine Heart Association has a recommendation yung parang gumaganon.
Yes, while sitting
It's
down.
modified. I forgot. It's the modified squatting. po ba?
Yes,
What-
yes. So
It's like this.
move around while you're
It's like
sitting.
we're doing
then-
like this.
Yes.
We were just marching in place.
Correct.
And if you do that for a straight minute, I guarantee you'll feel a little bit breathless, no? Because it really helps your heart, I
Yes.
believe. So it's not an excuse to just say, I'm busy.
Correct.
In the clinics, no, we're always
Yes.
just seated for hours. So in between patients, I do that.
Yeah, you can do that or walk
I stand
around.
up.
Yes, stand up, walk around. You know, so these are the
So-
things that we should be doing to achieve a healthy lifestyle. So aside from eating right, moving more, we should also sleep better. So we should
Yes.
have continuous sleep without frequent awakenings. Deep sleep is important, although we cannot really control that, but we do have measures in order to put us into that state. 6 to 8 hours of sleep every day is encouraged.
It's really important. I think there is an epidemic now of lack of sleep.
Yes, and insomnia. Yeah.
Yes. So if you have insomnia, then it's also imperative that you try to look for the reason for this difficulty sleeping or
The underlying cause.
There
of
might be a
these-
medical cause to it, like
Correct.
obstructive sleep apnea, or
Correct.
it could be too much Netflix.
Yeah.
or too much watching the news or
And
TV.
social media as well.
Social media.
Yes.
So eat right.
Eat right,
Move more,
and
and
sleep
sleep
better.
better.
And of course, lastly, I would like to again emphasize that we should seek prompt medical attention as early as when we feel these symptoms that we have just talked about. Know your numbers, which is an advocacy of the PHA and even the American Heart Association. Your cholesterol and sugar levels, so that this might be given attention to and treated properly.
So know your numbers, your blood pressure,
Yes.
your cholesterol level,
And your sugar
and
levels.
sugar
as
levels.
well.
Yes. Thank you, Doc. Doc, regarding lifestyle tips, aside from food and moving about, sleeping more, is there anything else that's important for our viewers to remember?
Yes, Dr. Jing. No? So it's important to limit your alcohol intake. No? Stop smoking.
Stop smoking.
Yes,
as in
that's
stop,
very
not just
important. Not
reduce.
just limit, but not just reduce or limit, but
Really
stop
stop
smoking. And it is interesting also to tell our viewers and everyone that vaping is also considered smoking.
I see.
And I think even worse because one drop of this vape liquid is equivalent to smoking 15 sticks of a cigarette.
One drop of the vape liquid.
Yes.
15 cigarettes.
Yes.
Ang dami.
Yes, ang dami, diba?
And then what does nicotine do for the heart? Or what are the side effects?
Well, scientifically, it hardens your arteries that leads to
High blood pressure.
yes, and even high cholesterol as well. So it is imperative to let everyone know that we should stop smoking or vaping.
So that's limit alcohol intake, stop smoking, and stop vaping. It's a very popular pastime these days.
Yes,
A lot of
yes.
smoke, a lot of vaping shops I see in the city.
Yes. Also, we should take into consideration our mental health. And
Very important.
yes, and lessen stress in our lives.
Lessen stress.
If possible, yes.
Because, Doc, diba, it's not possible to have no stress. Kasi I read somewhere, if you don't have stress, then you're dead. No?
Yeah.
So we just have to manage our stress. Know
Correct.
when it's time to take a break, to sleep, relax, whatever, meditate, what works for you. We all have different stress busters, but it's important to know our limit and maybe stop for a bit
Yes.
and pause. Thank you, Doc Edna, for your tips, recommendations, and insights on women's health. So these will greatly help our viewers in ensuring that their heart is always healthy. So, Doc, before we wrap up, any final messages or tips to our viewers?
Yes, Dr. Jing. Siguro it's important that we recognize the symptoms that we feel, and heart disease in women is real. So if we have signs and symptoms, we should not take these for granted. Seek medical attention for early prevention of heart disease. So we adapt the lifestyle that we have just talked about. Seek medical attention. Go to St. Luke's. We have internists and cardiologists who can work you up in order for you to know the status of your heart at any given time.
Because we have to remember we only have one heart. Well said, Dr. Lim. I learned some new things today, especially about that vape. And thank you so much again for joining us in our first podcast for St. Luke's Medical Center. And this is Jing. Thank you for tuning in to MD in Focus. Remember, your health is your greatest wealth. Always consult your St. Luke's specialist for more reliable health information. Remember to click the follow button. And until then, stay well.